Today we will be exploring the Doppler echocardiogram technique. This is a non-invasive clinical technique. We will be looking at a general overview of the technique, focusing on its limitations. Then we will move on to explore a research study that uses this technique.
Christian Doppler famously discovered the Doppler effect in 1842. He recognized that sound wave frequency increases as its source moves toward an observer and decreases as it moves away. Think of how sound from a blaring ambulance siren seems to get faster as it zooms toward you, only to get slower as it moves away. Fast forward to now, where the Doppler effect is more relevant than ever, and ultrasound imaging techniques are essential to modern medicine. Ultrasound imaging uses high-frequency sound waves, beyond human hearing, to create detailed images of internal structures. An ultrasound transducer is used to emit a beam of ultrasound waves and receive echoes of those waves that bounce off the boundaries between tissues in the wave's path. Echoes that hit the transducer generate electrical signals, which are used to generate two-dimensional images. But wait, what if we're trying to create images of structures of the body that are moving, like the heart, for example? This is where the Doppler effect becomes especially useful in medical imaging. Doppler echocardiography is a type of non-invasive heart exam that uses ultrasound waves to image blood flowing through the heart. In this type of medical exam, sonographers estimate the left ventricle's stroke volume, which is the blood pumped out of the heart's left ventricle and into circulation throughout the body. This involves measuring the blood's velocity in the left ventricular outflow tract, which is the passage leading from the left ventricle to the aorta. Estimations of stroke volume are made based on patterns in blood flow and the cross-sectional area of the left ventricular outflow tract. Non-invasive medical imaging techniques like Doppler echocardiography are crucial as they help medical professionals identify and track disease without relying on invasive measures like biopsy or surgery.
Yes, Doppler echocardiography as a method to determine how well blood is flowing through the heart has been a great advancement in modern medicine, but there's a few limitations to keep in mind about this technique. First, in order to obtain accurate and reliable results from this technique, the ultrasound beam has to be parallel to the direction of blood flow. This can cause results that could lead to a misdiagnosis from under or overestimating the velocity at which blood is flowing in and out of the heart. However, because of the advanced mathematical theory underlying this technique, we can assume that anything within 20 degrees difference parallel from the direction of blood flow has a small enough effect on the calculated velocity that it can be ignored. Secondly, due to pressure recovery, the mathematical theory for this technique overaccounts for the pressure gradient. This means that when blood has passed through a narrow passageway, the velocity at which the blood flow is moving at will decrease because of the difference of kinetic energy being converted back into pressure. This leads to an unnecessary diagnosis and thus unnecessary treatments or procedures done on the patient. It becomes even more of an issue when investigating issues in patients that have other variables not accounted for in the mathematical model, such as longer narrowing, which introduces factors such as friction. Lastly, another limitation of this technique is that it just isn't fully utilized in modern medicine, and therefore its full capabilities have not yet been determined. However, it is becoming a more common technique over time.
Having explored the Doppler echocardiogram technique, we will now move on to investigate a study that uses this technique. Right here is the title of the study we will be looking at. In this study, researchers investigated different methods of measuring left ventricular systolic function, specifically in the context of it being a parameter for cardiac assessment. One method in which this has been done is through the measurement of left ventricular ejection fraction. Through this study, researchers want to investigate if stroke volume measured through a Doppler echocardiogram can be used as a more accurate measure for left ventricular systolic function. So they investigated the correlation between left ventricular ejection fraction and stroke volume or stroke volume index estimated by Doppler echocardiography in patients admitted to intensive care with ST elevation, myocardial infarction complicated by cardiogenic shock, and reduced left ventricular ejection fraction. This study is a primary, observational, clinical, and retrospective study, as data was collected based on patient records with specific inclusion criteria. 2 methods of left ventricular ejection fraction were studied as well. Stroke volume was determined through a Doppler echocardiogram, and statistical tests were then performed to compare the 2 methods of measurement. It was likely hypothesized that there is a significant positive correlation between left ventricular ejection fraction and stroke volume or stroke volume index estimated by Doppler echocardiography in these patients. Researchers likely predicted that there will be increases in Doppler echocardiography's stroke volume as left ventricular ejection fraction increases for both methods used for these patients. In terms of statistical testing, these alternate and null hypotheses were likely used, with the alternate hypothesis being that there is a significant positive correlation between left ventricular ejection fraction and stroke volume or stroke volume index estimated by Doppler echocardiography in these patients, while the null hypothesis being that there is no correlation between these 2 variables in these patients.
Now, let's examine Figure 1a from the study in detail, as it visually illustrates the connection between the left ventricle ejection fraction, so LVEF, and stroke volume, SV, assessed through Doppler echocardiography. So, this figure is crucial as it specifically responds to the research question: what is the relationship between LVEF and stroke volume, or stroke volume index, SVI, in individuals experiencing cardiogenic shock, CS, with diminished LVEF. So according to the study's hypothesis, we would anticipate a notable correlation between these values, indicating that as LVEF rises, there will also be an increase in stroke value. So in Figure 1a, a scatter plot displays data points corresponding to individual patients. The trend line in the graph facilitates the visualization of the connection between LVEF and SV. A positive slope indicates that as LVEF enhances, stroke volume is likely to increase, reinforcing the study's hypothesis, and Doppler-derived stroke volume can be considered a dependable indicator of cardiac function. It is crucial to acknowledge the dispersion of the data points in relation to the trend line. Certain variability indicates that although a correlation does exist, additional physiological factors could also affect the specific relationship. This emphasizes a significant conclusion of the study, that Doppler echocardiography is an important instrument, yet it should be utilized in conjunction with other clinical evaluations for precise diagnosis and treatment strategies. So then, in summary, Figure 1a supports the notion that Doppler echocardiography is a reliable tool for estimating stroke volume, and it offers a significant non-invasive approach to evaluate cardiac function in critically ill individuals. This method is particularly beneficial in situations where conventional LVEF evaluations may be restricted due to the patient's state or difficulties in imaging.
To summarize what has been discussed today, the Doppler echocardiography is a 2-dimensional ultrasound imaging technique of the ventricular area of the heart. This has been a useful technique in the medical industry as it is widely available and an easily accessible tool. As well, it is non-invasive, so does not require major surgery. However, when used alone, it is susceptible to misdiagnosing and mistreating heart conditions. Through the use of stroke volume and left ventricle ejection fraction, this can be refined. The left ventricle ejection fraction is a fractional measure of the amount of oxygenated blood that pumps out of the left ventricle into the body. This measurement is used to see if the left ventricle is dysfunctioning. The higher the fraction number, the healthier the heart. For example, a healthy heart has an ejection fraction of 50 to 70%, which means that with every heartbeat, 50 to 70% of the blood from the heart is pumped into the body. The stroke volume is a measure of the velocity of the blood pumped out of the heart, following the left ventricle outflow tract, starting from the left ventricle chamber and pumped into the aorta. This measure is useful as it pairs well with the Doppler echocardiography in that it provides context and understanding to the 2-dimensional ultrasound image. This measuring technique also allows to detect dysfunction in the heart. Overall, these 2 ways to measure blood flow in the heart provided an added level of detail and knowledge to the Doppler echocardiography non-invasive technique.